The first question that we're getting is I'm hearing so much on the news and it's so confusing. What is happening?
So what we're hearing about in the news is we're hearing about what some people call coronavirus or COVID-19. And we're hearing about a lot of people who are being sick. And also we're hearing about a lot of changes we need to make sort of in how we're living day to day, where we can go, what we can do. And I think that can be really upsetting and sometimes scary for people. So we wanted to talk a little bit about what kind of symptoms or what we might feel if we have COVID-19 to help people understand a bit more about it.
Yeah, so symptoms we've been hearing are things like, I guess, a fever, really high fever, dry cough, so something where you're not bringing up any stuff when you're coughing. It's just you're making the loud sound that comes with the coughing, but nothing's coming up. And then people are having some muscle aches as well. And I think those are the most common symptoms that people are having when they're having sicknesses or illnesses with COVID.
I think we have a picture showing some of those things, Irfan. Do you want to show that?
For sure.
There we go. So the three things that people are worrying about the most, I think, so the cough is a big one. And you'll notice how this guy's coughing. And these are photos actually that came from Surrey Place with some of the self-advocates that we work with there. So he's coughing right into his sleeve to make sure he's not spreading it. And then we see that high temperature, the fever, and also really difficulty breathing. And you mentioned also the soreness sometimes in your muscles. Sometimes when you feel like you have the flu, you feel kind of all achy and kind of woozy inside.
Yeah.
So I guess that's another symptom. It's tricky though, because it's the same really as what you'd feel like when you might have another kind of flu. So we don't really know that it's COVID or that it's another kind of flu. Yeah. But certainly people feel unwell. But some people just feel like a little bit unwell. It lasts for a couple of days and then they're okay. Some people actually, we don't even know that we're feeling it because we're not really showing symptoms or feeling sick at all, but we still have it in us. And the important thing is we can still spread it when that happens, right?
Exactly.
But there are some people who we really worry about if they get these symptoms, right, Irfan? So who would those people be?
I think the people we're most worried about from what we've been hearing is those people who are older. So anybody maybe 65 years old or older than that, or we're really worried about them because they can get really, really sick and need to go to the hospital if they get COVID. Another group of people are people who have other health conditions or other health problems that make it more likely for them to become very sick with this disease. So those are, I think, two big groups of people where we really want to avoid them and stop them from catching the virus, or because they can really, really fall sick and need a lot of care in the hospital to make sure that they don't get worse.
Right, and I guess we're kind of thinking about how to help those people who can get really sick not get sick, but also making sure that people don't all start to feel sick at the same time. So we're doing a lot of things to try to slow down how much different people get sick at the same time.